Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing this morning?
Doing very well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, US COVID statistics, and answering a viewer-submitted question through today, May 10th. We invite you to submit any questions you have down below via Facebook at MU Institute for Global Health or at email globalhealthinstitute@northwestern.edu. Starting with the abbreviated US COVID statistics, as we talked about last week, new case estimates and hospitalizations will no longer be reported. This may change in the future, but for now, we have the average new hospitalizations per day from the week of 4/27 at 728 and average COVID deaths per day at 33. Dr. Murphy, your reactions to those numbers?
Yeah, basically the same as last week, very close. We're down below 50 deaths per day, but even at 33, that's still an awful lot of deaths per year. And the hospitalizations, of course, are still rather large. Relatively speaking, it looks good, but it's still bad. I think a lot of that is that people are not keeping up with the vaccines, the vaccine uptake. We're not even going to report that anymore because it's hardly ever changing. But, very few people are really up to date on the vaccines. Now, there's going to be a new one coming out in the fall against the newer variants that are out there. And it's highly recommended that, people take that. So you can even take it at the same time as a flu shot.
Mhm. And I understand while the respiratory season is at its end, there has been some action on the flu front and also with this new COVID variant being nicknamed FLIRT, or several variants under that categorization. Can you tell us a little more about those?
Yeah, so as expected, this is the end of the respiratory virus season now, which would be the serious ones are flu, RSV, and COVID. So they're all coming down, which is great, but still this week they reported an additional 10 pediatric deaths from flu. And there was a total in the entire flu season of 158 pediatric deaths. It's just devastating. Flu vaccine is recommended in children 6 months of age and older. So, they have trouble handling this infection. It's really tough, but the numbers are coming down for all three of them. Now, the FLIRT variant, we talked about it already. We weren't calling it FLIRT, but the FLIRT is just, it's another Omicron family virus. We were calling it KP.2 or 1.1. But it's nicknamed FLIRT because of where the mutations are occurring in the spike protein. So it's definitely more contagious because it has just taken over what was going on out there already. There's only one way something can take over, and it's easier to transmit. So this is just the natural way the viruses behave. It doesn't look like it's any worse. It's in the Omicron family. The Omicron vaccines should still work, and they will most likely gear it even more. The vaccine that comes out in the fall will be geared toward these type of viruses that we're seeing now. So this is just a natural thing. And remember, with COVID and with flu, immunity wanes. It goes down over time. It's not like measles where, that thing hardly ever changes and the vaccine you had when a kid still works. That's not the case here. So immunity does go away, and that's the unfortunate thing why we have to keep up with these vaccines.
Absolutely. And on that note, because it is more transmissible, do we have to worry about some huge summer wave, or do we think that, there may be some more cases, or what are your predictions on that front?
It's really hard to predict. But COVID is famous for having peaks off season. Remember Delta from, I think, 2021? You know, everyone thought, oh, the virus is going to be gone and, you know, that's over. And then all of a sudden in August, late July and August, huge wave of Delta. And Delta was a worse disease. So we'll see. Because COVID is different from RSV and flu in that it can occur any time of the year. So we'll see what happens. So with that, I wouldn't be surprised. But, you know, there's a lot of immunity out there. People have had COVID once or twice, you know, whatever, and people have had the vaccine. So that is really going to make a difference. Now, if you look at the flu wave of the 1918 flu pandemic, now this is flu, not COVID, but, you know, they had 3 massive waves and then it just disappeared. Well, it got down to a low level. We still have flu, obviously. But, you know, are we done with the peaks? We don't know. We'll see.
Alrighty, well, we'll keep up with the wastewater monitoring of that data then, as the other things are no longer being reported.
We're better prepared.
Now, the biggest story we've been talking about over the past few weeks and now months is avian flu, H5N1, mostly in dairy cows and in humans. But there are some more revolving factors coming out this week, recommendations for dairy workers, all of these important things, questionable case numbers. Can you break this down? It's a huge topic.
Yeah, why is this a huge topic? Well, there's a couple reasons. One is that avian flu really devastates birds. That's why they call it avian flu. It's also called H5N1. The birds die off in droves that are infected. It's unusual for it to affect a human, all right, but it can happen. And the problem is, and the animals that do get infected, including cows, is it going to be worse than the regular, the other types of flu? Now, if you look since 2003, there have only been 889 confirmed cases of human infection with avian flu. However, 52% of those people died. All right. This is why everybody is worried about avian flu. This is going to be, if avian flu mutates to the point where it can go human to human very easily, you know, there could be a lot of trouble. Now, there's already 3 companies that make a vaccine for avian flu, believe it or not. They're just in the wings out there, waiting for this thing to get worse. So, you know, we're much more prepared if that does happen. So far in the United States, there's only 2 documented human cases. Both of them survived. But in Asia, there have been many more cases, and some of them have died. So that's one thing. The other thing is that just in the fact that it affects the birds so much, United States Department of Agriculture, USDA, states that they have spent over $1 billion since 2021 culling and managing the infected poultry in this country. And so we have to be very careful. This could be a very expensive disease. And now we're finding out that cows can be affected. They do get sick, but they appear to get better. We don't see them dying off in droves like the birds. So, you know, maybe it's going to be like the humans, but it's in the milk. And the milking equipment does play some kind of role. And the udders of the cows are loaded with virus, it turns out. And viral particles have been found in milk. We talked about it last week, but the pasteurization kills the virus. So the milk is safe if you're drinking pasteurized milk. Unpasteurized milk would not be safe now. All right. So it does appear that in the cows, it's mostly the lactating cows, the dairy cows that are the ones that have this. So it's being looked at very closely. And, you know, they're looking at wastewater around dairy farms and finding it and whatever. But at this point, there's a lot more unknowns than knowns. And, but it is something that is being looked at very closely.
Mhm. And while I understand that there has been 2 human H5N1 cases in the US, one related to this recent outbreak, I've read suspicions that there could be more cases out there. What's the
Oh,
deal with that testing?
yeah, so, people are not routinely tested for avian flu. You have to do very specific tests. And it's very likely that dairy workers have been infected. There's been case reports that they get sick, they've got a respiratory infection. The good thing is, even if they have it, which we don't even know what kind of disease they had, I mean, they're not dying at any kind of 50% rate. They're not dying at all. So but it's just an unknown at this particular point. But there's likely a lot more than 2 cases. That's kind of the point, what they're trying to make. And hopefully this is going to change, so we could just get some information, because maybe it's not going to be so severe, or there's something we can do about it. We have these vaccines I mentioned out there. Maybe dairy workers should all be taking that vaccine. Why not? These vaccines are approved.
Yeah, that's a really great point, and we will, of course, look for more information on the subject as it comes out. Now, our next story today is a little bit different. There has been a reported outbreak of tuberculosis in Long Beach, California. While the overall risk appears to remain low, can you tell us a little bit about this outbreak?
Well, tuberculosis has been around for millennia. And what happened in the city of Long Beach, California, is they had 14 confirmed cases at a single room occupancy SRO hotel in Long Beach. So these are where a lot of poor people with very limited resources, they live in these single room hotels. So anyway, 14 confirmed cases, that's a lot for TB, and they exposed another 170 people. So those people are being tracked. It's very expensive to track those people, make sure they don't get sick, and if they get sick, to treat them. Step back to 1945, before there was good treatment for TB. In 1945, the end of the World War II, there were 115,000 new TB cases in the United States. 63,000 of them died from tuberculosis. So tuberculosis can have devastating effects if it's not treated right. We see a lot of it in low and middle income countries around the world, especially in combination with HIV infection. It's really devastating. We've got to keep our guard up and tackle these things before they become even bigger problems.
Mhm. And on the note of trying to tackle things before they become bigger problems, there are new reports out of New York City of a substantial rise in Mpox following a health alert. Can you break that down for us? I know we previously had some Mpox here in Chicago. Maybe our viewers
Still have,
aren't as familiar. Yeah.
we still have Mpox here in Chicago. But what this report is a big rise in the number of cases. It pretty much doubled in the last month or so. So there were 256 cases reported. That was a 73% of the cases occurred in those who were unvaccinated or had only received 1 dose of the vaccine. This is a 2-dose process of the vaccine that's approved now. So undervaccinated, only 1 dose. That's who's driving this problem. And to put it into some kind of perspective, of the 256 cases, 10 patients were hospitalized. That's 4%. So, you can get very sick from Mpox. Now, we're not seeing a lot of deaths. Now, there's 2 clades or 2 types of Mpox. Clade 2 Mpox, which is primarily what we have here in the United States, typically has milder symptoms. Clade 1 is the ones we find in Central Africa and other places. And there, they've had 19,000 suspected cases and more than 900 deaths. So very different in different parts of the world. But anyway, this is another disease that's preventable. People that are at risk can take a vaccine that's very effective. And just another thing that can be prevented than getting infected with this Mpox virus.
Mhm. And the vaccine has been proven to be safe and effective. For those who receive their full
Yeah.
course, they can wait 2 to 10 years, depending on your level of risk, before receiving a single
Yeah.
booster dose.
Yeah.
Also, Dr. Murphy, you have previously noted that if you have had a smallpox vaccination, you may only need 1 additional dose of this
Right.
Jynneos vaccine.
Yeah, this Mpox is related to smallpox. So, in people born, typically, I think it's 1955 or so. If you've had the smallpox vaccine, you have some protection. And you might only need 1 dose of this Jynneos vaccine if you're at risk. Good
Mhm.
point.
So our final story today is a really great study from the Department of Health and Human Services here in the US. They were looking to analyze the monetary effect and the life-saving effect that their COVID vaccine campaigns had on the nation and on the general public. Can you break down their findings?
Yeah, so this is a classic epidemiological study. And it got published, and they looked at the number of COVID cases from April 21 to March 2022, 1 year period of time. And they had this big campaign to encourage people to have the 2 doses, at least the 2 doses of the vaccine. So their study shows that an estimated 22+ million people completed the COVID vaccines. If in addition to what was already going on out there. So the campaign contributed another 22 million to the 55 million doses that were already given. And how that breaks down and how they measure how effective it is the vaccine campaign that resulted in these extra 22 million doses resulted in 2.5 million fewer mild COVID cases, 244,000 fewer non-fatal COVID-19 hospitalizations, sick enough to go in the hospital with COVID, and saved 51,675 lives over the study period. This is just a 1-year period. So this is from 21 to 22, not that long ago. So the campaign benefit was, if you measure all the expenses related to the hospitalizations and deaths, the loss of income, and all the catastrophe associated with that, was $740 billion. Prevention is so much more efficient than treating people who are already sick. So this $740 billion saved. So the campaign itself, of course, has an expense. But for every dollar invested in the campaign, resulted in $90 in saved benefits. So this is classic, preventive, you invest in the prevention and you save 90 times the cost of the prevention. So it's a beautiful study done by some very clever people that understand, how the population gets infected and what happens with them and how much it costs. And it's just more evidence that, prevention is a very efficient way to manage this disease and many other diseases.
Mhm. Yes, I highly recommend this paper in the American Journal of Preventive Medicine if you're interested in reading about their methods. They are very complicated and very interesting. So a great big recommendation from us. But on that note, I'd like to thank you, Dr. Murphy, for your time and expertise answering our viewer submitted question about those FLIRT variants, as well as all of the recent studies and US COVID statistics.
Great. Thanks, Katie.
And thank you all for joining us for another episode of the Ask Dr. Murphy series. As always, please submit any questions you have down below or through any of our social medias linked in the description. We'll see you next week. Have a great weekend.